I just wanted to start by saying thank you to all of our judges for your time and attention, and we'll go through some introductions. So I'm Amanda Cordy, and I'm from St. Louis, Missouri.
I'm Allison Tao, and I'm from Reno, Nevada.
I'm Buket Kutulus from Coburg.
I'm Charlotte Becker from Coburg.
I'm Patrick Wegweit from Poland.
So it's a pleasure to present our research proposal in front of you. Our study will investigate the effects of meditation on memory impairment in adults with mild cognitive impairment. So our research question is, how do mindfulness meditation and Kirtan Kriya meditation can affect the memory and function in adults with mild cognitive impairment?
Within the process, we asked ourselves 3 sub-questions. The first one is, do mindfulness meditation or Kirtan Kriya meditation improve memory functions in adults with mild cognitive impairment? Which leads us to the second question, if mindfulness meditation and Kirtan Kriya meditation are found to improve memory function, which is more effective in adults with MCI? The last question we asked ourselves is, how do mindfulness meditation or Kirtan Kriya meditation affect memory-associated structures in the brains of adults with MCI? This is why we are going to inform you about the background information of the meditation techniques we choose and the significance of our study.
Mild cognitive impairment causes cognitive changes that are serious enough to be noticed by the affected person or by family members and friends. MCI can develop for multiple reasons, and individuals living with MCI may go on to develop further dementia, others will not. For neurodegenerative diseases, MCI can be an early stage of the disease continuum, including Alzheimer's disease. In some individuals, MCI reverts to normal cognition or remains stable. In other cases, such as when a medication causes cognitive impairment, MCI could be mistakenly diagnosed, which is also worth noting. What is widely known about the etiology of MCI is the brain atrophy. Hippocampus, not visible in MRI scans presented below, is a region that preferentially atrophies in MCI. What is also important is the atrophy of the cerebral cortex, especially frontal and temporal lobes, which is visible in this image. In the scans presented on the bottom of the slide, we could also see the enlargement of ventricles.
So now that we have the background information on mild cognitive disorder, we'll go into the significance of our study and our question. So various forms of dementia, including Alzheimer's disease, are becoming increasingly prevalent in older adults, and MCI is common in older adults across the world. Globally, more than 6% of people in their 60s have MCI, and this number increases to more than 37% by age 85. Adults with MCI have an increased likelihood of developing dementia, as MCI cases progress to dementia about 15% of the time among people 65 or older. The prevalence of MCI and dementia can be attributed to what is called a graying society, which means that the population in many developed countries has a large portion of elderly people. As people live longer, they are more likely to develop these neurocognitive diseases, which are not only difficult for patients and their loved ones, but are also taxing on healthcare systems and institutions like nursing homes. With this in mind, the use of meditation for memory improvement would have a substantial impact on MCI treatment and possibly even dementia treatment. If meditation is found to be successful for memory improvement in adults with MCI, meditation practice could become an easy and affordable way to improve or limit memory deficits caused by MCI.
It is expected that both Kirtan Kriya Yoga meditation and mindfulness meditation, both as one of the most common meditations, will have a positive effect on subjects of the presented study. We also have to consider the fact that Kirtan Kriya meditation involves some motor stimuli in its practice, which may at some point positively contribute to the overall state of patients with mild cognitive impairment. It is also predicted that meditation practice will positively affect cognitive functions, including episodic, semantic, and working memory in meditating participants of this study. We also anticipate that the gray matter concentration in memory-associated areas like hippocampus, posterior cingulate cortex, and the poroparietal junction, among others, will be positively affected by meditation practice. These are hubs associated with self-awareness, emotion, and cognition, which are important factors through which meditation may contribute to the better state of meditating participants.
We also have to look how meditation can improve our memory. It is known that stress is critically involved in the development and progression of neurodegenerative diseases. Through meditation, it is possible to decrease stress and generate relaxation. Studies have also shown that meditation can increase cerebral blood flow in the frontal and parietal lobes, which are both associated with memory retrieval. Both Kirtan Kriya meditation and mindfulness meditation have had some clinical success in improving memory capacity in adults with MCI, but they have not been compared and need to be replicated in larger studies.
Kirtan Kriya is an ancient chanting meditation. Kirtan Kriya is part of the Kundalini yoga practice taught by Yogi Bhajan. This particular meditation technique is a mixture of repetitive finger movements as well as chanting the mantras Sa, Ta, Na, and Ma, meaning birth, life, death, and rebirth. While the subjects are saying these mantras, every mantra is connected to a certain finger movement. When they say Sa, the finger touches the thumb. When they say Ta, the middle finger touches the thumb. When they say Na, the ring finger touches the thumb, and with Ma, the small finger touches the thumb. The subject's eyes should be closed and they can sit comfortably. These mantras are going to be repeated 5 times with different volumes. The first one is chanted in normal voice for 2 minutes, then the second is chanted in whisper for 2 minutes. For the next 4 minutes, the mantra should be chanted in silence, then the subject continues whispering for the next 2 minutes, and the last 2 minutes will be chanted loudly. After the meditation, it is recommended to stretch. This meditation can be done within 12 minutes, which makes it really easy to build in the subject's daily routine.
The next meditation that we included in our research is mindfulness meditation. Mindfulness meditation is a very unique type of meditation that will help ease your stress level. So first, the subject wants to settle in and find a quiet place. They will sit up straight but not too stiff with a chin up, and they will allow their head and shoulders to rest comfortably and place their hands on top of their legs with upper arms at their side. Next, they just want to take a deep breath, close your eyes, relax, feel the fall of their chest, and try to notice the coolness as it enters and the warmth as it exists. And they will try to follow their natural flow of their breath. While meditating, they want to stay focused, so they want to notice their thoughts, but don't pass them. Return their focus to their breath, and they want to try to listen to the environment around them. The subject will do this 10 minutes per session daily. It will decelerate thoughts of stress, negatives, and calm both the mind and body when in a pressured period of time. It is known to improve awareness, acceptance, and self-efficacy. Many participants who has participated in this type of meditation has become more mindful of their relationship in life.
So on to our study design and methodology. So our study will consist of a sample of 120 adults clinically diagnosed with MCI. There will be 60 men and 60 women, and some of the inclusion requirements for our subjects were that they must be at least 60 years old, have no previous experience with meditation, they must not be currently taking any medication for MCI or its symptoms. So at the beginning, all subjects will complete 3 baseline tests: the University of Southern California Repeatable Episodic Memory Test, the Forward and Backward Digispan Test, and MRIs. Then the subjects will be randomly assigned into 3 groups, each consisting of 20 men and 20 women. So group 1 will be practicing mindfulness meditation, group 2 will be practicing Kirtan Kriya meditation, and group 3 will act as our control, and they will be not practicing any meditation. So they'll enter an 8-week instructor-guided meditation period in which they meditate 5 times per week. And then at the end of the 8 weeks, they will all complete the 3 tests again. So they once again complete the USC REMT, the Forward and Backward Digispan Test, and MRI. Next, remaining in their previously assigned groups, the subjects will enter a 4-month self-guided meditation period where they will be recording and journaling every time they meditate. And then at the end of the 4 months, they will all complete the 3 tests once again. And at the end, we will compare the results of all the tests. So now we'll go into a little more detail on the tests that we will be using to evaluate memory function.
The first examination, the Southern California Repeatable Episodic Memory Test, is divided into 3 parts. The free recall test has 3 study test trials. For the study phase of each trial, subjects are instructed to memorize 15 target words that are orally presented by the experimenter at a rate of 1 item every 2 seconds. Target items are presented in a different order for each trial to assess subjective organization. During the test phase, subjects try to recall as many items as possible in any order. The yes-no recognition test immediately follows the third recall trial. A list including the same 15 target items as the free recall task plus 30 unrelated distractor items is presented with all words in random order. The experimenter phonetically presents one word at a time at a pace set by the subject's response rate. Subjects will be instructed to respond yes if the item was previously studied on the free recall list, and no if the item is new. In the fourth choice recognition test, there is a single study phase, with the experimenter phonetically presenting the 15 targets at a rate of one item every 2 seconds. During the test phase, the experimenter reads groups of 3 words, 1 target item, and 2 distractors. Subjects being previously told that in each trial, one of the 3 words is a member of the study list indicate which word was previously studied. The whole test procedure is predicted to take around 10 minutes for each participant.
Right, so the next test that we will be using to assess memory function in our subjects is the forward and backward digit span test. So this test consists of 2 phases, the first being the forward digit span test. So in the first phase, a sequence of 3 to 8 digits will be verbally presented to the participants at a pace of about 1 digit per second. The participant will be asked to repeat the full sequence exactly as it was presented. If a sequence is reproduced correctly, the participant will be given the next larger sequence. So for example, if a subject repeats a 3-digit sequence correctly, they'll be next given a 4-digit sequence. If a sequence is reproduced incorrectly, the participant was given a second sequence of equal length. If the second sequence is also reproduced incorrectly, the instructor will move on to the next phase, the backwards digit phase. This phase has a similar structure as the first, but the participant will repeat the sequence in backwards order rather than forwards. The number of correctly repeated sequences represents the score of interest or the dependent measure of this test. This test measures maintenance and recall of information, with short-term memory being measured in the forward phase and flexible processing of information stored in the working memory being measured in the backwards phase. And then the last test that we will be doing is MRIs, and we'll be using those to measure gray matter concentration in our subjects. So previous studies show that mindfulness meditation practice can increase gray matter concentration in the hippocampus and other regions associated with memory in healthy adult brains. And gray matter is involved in processing information in the brain and connecting the brain to various parts of the body. So this suggests that increased gray matter concentration in the hippocampus may indicate improved memory capacity and function. Therefore, we will use MRIs to determine if gray matter concentration is improved in the hippocampus and other memory-associated regions in adults with MCI after practicing meditation. And now we will go on to the dialectical, ethical, legal, and social considerations.
So, when we think about limitations, we have to consider that our sample size is optimistic. It may be difficult to acquire 120 qualifying participants, especially with an equitable distribution of gender and ethnicities. It's also important to acknowledge that patients with MCI may already have varying degrees of memory deficits. This may influence how meditation impacts their memory function. Another point to regard is that it is possible that patients may not continue to adhere to their meditation regimes during the 4 months self-guided meditation period. This would influence the result of our study. Another crucial point we have to contemplate is that the causes of MCI are largely unknown. Because of this, it may be difficult to determine what mechanisms causes meditation to affect memory function in adults with MCI.
When we think about the social and legal implications, we have to consider that African Americans may be more represented in this study than other biomedical studies, as they have an increased likelihood of developing MCI. Furthermore, elderly care facilities may begin to offer meditation classes for dementia patients, which would be a substantial benefit of these results. Meditation practice could become much more common in Western societies, which brings the risk of appropriating cultures or religion in which many of these meditation forms originated, which is not our purpose when we use these meditation techniques. In addition, not all insurance companies cover meditation and mindfulness classes or training, which will put those who cannot afford these services at a disadvantage.
The ethical considerations of our research. So one positive ethical is that audit techniques used in the study are non-invasive. The range of positive effects of meditation is wide, and there is some evidence of negative effects of meditation. Another factor to consider is that participants will not be able to use medication for MCI during the studies, and participants of the study will be unable to be considered in other studies. And thank you for your time and attention.
All right, well done, you guys. As you can see from Dr. Giordano as well.
That was awesome. That was absolutely positively 100% awesome. Presentation was great. Content was great. Methods were great. Quality was super. Collaboration was boom. I mean, wow. Just simply wow. Nico, over to you.
Thank you, Jim. Sorry, I'm having internet difficulties, but that was brilliant. It made my heart and my brain shine. That was just mind-blowing. Excellent. Excellent. Wow. This was really, really deep into it, and you made it all. You made my day. That was excellent. I mean, this is an issue that has been largely neglected, and look at it from this viewpoint. In the last 10 or 15 years, I guess we have put more than a 3-digit billion number into dementia research. I wouldn't go as far as to say that the results are nil, but they're moderate. And the only predictor that has so far come out of this is chronic distress, plus some genetics. But let that aside, I think what you have tackled is really an issue that needs to be put into further investigation. And the most important issue is this is non-invasive, ladies and gentlemen. And I think mild cognitive impairment, given the social demographic change that we're facing, that will be the issue of the time, at least for Western societies. And we have, until now, we have no way to tackle that. We even don't have a clue how to sort of deal with that. But the only thing that might actually be able to address that is change of lifestyle. And I think what you have actually presented is just a blueprint for what is to come. And I would even go, the only small comment I would have is you could actually use that a bit earlier before the onset of mild cognitive impairment and see if you start in an earlier age. And that is, ladies and gentlemen, the reason why I'm so keen on sort of trying to introduce mindfulness and other mind-body techniques, regardless of what the actual venue is, into educational systems, school systems, and at the higher educational systems, because it has to do with self-regulation. You made my day. That was absolutely mind-blowing. I have nothing to add, but I'm so proud of you. That was brilliant.
How about if we go over to Professor Shook?
That was the slickest presentation. You guys need to go to New York City, Berlin, Paris, or London and put this in front of, oh, I don't know, an investment firm that sinks billions of dollars into trying to figure out techniques that work. Your presentation would have stunned everybody in the boardrooms of high finance corporations that are looking to sink the next big tech and wearable tech. Where to begin? I mean, you guys have a grip on very sophisticated matters. We've seen studies trying to link meditation with cognitive impairment, and usually it's a little bit of sort of too little too late. It seems counterintuitive, right? How could less thinking help improve with more thinking? And it's so counterintuitive and confounding that researchers are having a problem. You guys just cut through it. Sometimes with the brain, systemically, less is more. If you can diminish the distraction of the focus, right, you increase short-term working memory space, and that's going to enhance at least basic cognitive performance for anybody at any age, but particularly the adult crowd that seems to be particularly susceptible to this. Let me say visually, and others will probably say this as well, just beautiful presentation. I saw tables, charts, and graphs and diagrams that kind of made me drool a little bit. If I was drooling, I apologize. But it was a savory presentation. Fantastic on all levels.
It was. I want to hand the next discussion over to Professor Dr. Michael Heinrich. But before I do, 3 things. Number one, English is not your first language, and it was brilliantly done. I mean, not only was English not your first language, but we have someone from Poland, we have people from Coburg in Germany. I mean, working together, absolutely brilliant in a foreign language. Point number 1. Point number 2, I really like the bow tie. That's really cool. Point number 3, this is the kind of thing that both Dr. Shook and I and Nico or Professor Coles are working on. This might be the kind of thing where we might look to do actually a pilot study just like this. I mean, my thought would be we might want to see if something like this would be really useful for people who have mild head injury, who have minimal cognitive impairment, inclusive of people in the military. And this is wonderful because it's low tech. Brilliant.
If I had research money, I would hire you all on the spot.
Me too. Me too. I mean, so it's going to be my goal to see if there is available research money to be able to actually subsidize this study as a pilot study. And so I think that would be brilliant. Michael, over to you, my friend.
Yeah, I just wanted to add, and I would ask myself, how could I integrate the concept of beauty in the whole thing? Because I think this would make a very integrative topic altogether. The high relevance is clear. It was a high density contribution. Really, I learned a lot by that. Although, of course, Nico Coles told me many things about meditation, and I think aesthetics could make a good part of a good meditation technique to enhance the whole thing. So many thanks for that beautiful presentation.
Ja, und für meine deutsche Studierende, wenn es ausgezeichnet war, das war großartig. Wirklich muss ich sagen, ich war super beeindruckt und ich bin sehr, sehr stolz auf Sie.
Jim, tell them their English is better than mine and yours, I'm afraid.
I mean, certainly your English is better than mine. Your English.
But this was just also from the colleague from Poland. This was just outstanding English presentation. I wish I had picked up English language to the degree you have at your age. I mean, this is mind-blowing.
Yeah, me too. It's brilliant. 10 out of 10. Brilliant. Morgan, over to you.